Welcome to the International Congress of Agorà held in Milan. We are very proud to be here with Dr. Wong Vincent, trusted celebrity doctor, one of the London's leading cosmetic doctors. And we would like to ask you, what would you like to highlight regarding this Congress?
So this Congress has been a very enjoyable moment for me. I love the range of topics from the traditional techniques of how to use dermal fillers, toxins and other injectable products to the latest in the industry, for example, regenerative medicine, quantum resonance, and how all these different technologies can come together for us as physicians to be able to give our patients the best results.
Here we had a lot of sessions. I know that you published several scientific publications, but in this case, from a scientific point of view, also because you are specialized in transgender treatment, what can we tell to other doctors and to the public?
Okay. So when it comes to treating transgender patients, I believe there are a lot of barriers between the physician and also the patient. So, from a patient point of view, they're always nervous being in a new situation. So, they can come across very nervous, very scary for them. And from a physician point of view, we have to also be careful to not say something accidentally that may come across as offensive. So I think that's one of the biggest barriers, but that could be easily overcome by clear communication to the patient. For example, talking around pronouns, be comfortable with it and have an open mind. And when it comes to clinical challenges, obviously this group of patients within the LGBTQ+ community, they do face a certain level of stress and additional challenges that we may not necessarily be familiar with. For example, a lot of them would have mental health issues, anxiety, depression, and unfortunately the rate of suicide is also quite high. So this group of patients are quite sensitive, so we need to be careful, take that into consideration, and make sure that they have all the support that they need.
You won several awards. How is important to explain and to deliver high standards in aesthetic cosmetics?
I think the key thing to delivering high standards in aesthetics is firstly knowing the anatomy and also the technology they're using, creating a long-term treatment plan, and of course being able to communicate effectively to the patient and always staying on the trend, making sure you're at the forefront of the latest in technology. Aesthetics medicine, like all other fields of medicine, is a lifelong learning process.
You are an opinion leader. Nowadays, do we must really fight against fake news?
Definitely. I think we must really fight against fake news. There's so many different misconceptions surrounding aesthetics medicine. A lot of patients that I see on a day-to-day basis still worry about, the whole overfilled face, overdone, and all these, other news or negative things that I've heard or seen in the media. However, we also need to remember that, a lot of the bad press that aesthetics get as a field is also because that was make good news for the newspaper itself for them, and we need to bear in mind that there are a lot of good work going on and they don't necessarily get the media attention, but they do exist.
So thank you very much for being with us, Dr. Wong Vincent, and thank you to all of you for listening to us.